Hi, Dr. Prakriti. Today, let's discuss a common scenario we see. A 25-year-old executive who underwent a master health checkup comes to us with an ultrasound report showing a 3 centimeter hemorrhagic cyst. How would you proceed?
Okay, so first of all, when she comes to me with such a report, we would like to ask her about her detailed history, specifically her menstrual history, how her periods are, the regularity, is there any pain or any other symptoms that she is facing. So in case she reports any of these, we would think in that terms and would require further evaluation. The most common condition causing pain during periods and less bleeding when compared to the pain will be something known as an endometriotic cyst. So that can also come just as a simple 3 centimeter hemorrhagic cyst. So we'd like to further evaluate. Mostly MRI is the definitive imaging modality. So we'll do that, study the characteristics and offer her treatment options based on her symptoms. So if she has no symptoms at all and it is just a 3 centimeter cyst, given the size is small and there is no symptoms, we would definitely like to keep her under a follow-up, and this is very important. So when she's on follow-up, usually in certain intervals, so most commonly 3 monthly intervals, we repeat the ultrasound and see how the cyst is doing. If the cyst is bigger.
So does that mean that all ovarian cysts need treatment?
Not required, ma'am. So what all the factors that we consider is age, the desiringness of the fertility, and what are her symptoms, and what are the characteristics of the cyst on the imaging that we do, and the size. So if it is a simple cyst based on the characteristics and the blood reports, and if the size is small, we'll keep her under follow-up. If it is anything usually bigger than a 5 centimeter cyst, even though it is simple, we would like to intervene and suggest her to remove the cyst, because there is something called as an ovarian torsion, where it twists the cyst, twists the ovary, and the blood supply to the healthy ovary also will be compromised. So that time we'll require a surgical removal itself.
So a big simple cyst will require intervention, yes, but a smaller simple cyst you'll keep under follow-up.
Yes.
And any other kind of complex cyst you will evaluate, yes, because your differential diagnosis, what all would you think of, doctor, if it's a complex cyst?
If it is a complex cyst, first thing would be the benign conditions would be endometriosis, and also we need to consider the age and the history of malignancies which run in the family, and also suspect certain ovarian cancers also which come in as complexes. Cysts. So if it is something which is more pointing towards malignancy in our blood reports and evaluation, that will definitely require a surgical intervention.
Okay. Thank you, doctor.
Thank you.